Hi, I'd like to wish all the viewers of News Today health and happiness always.
The only book on aneurysm surgery at that time was Cooley's textbook, which is a small book which hardly gave any technical descriptions. He says cross-clamp aorta and aneurysmosgraft expeditiously without producing any spinal cord damage or tissue damage. So it's very easily said, but once you start doing, you can imagine once you cross-clamp, you cannot sometimes complete the surgery that expeditiously. With determination and perseverance, I was able to produce acceptable results. Of course, I have had some if I had had some formal training, probably I would have become much better surgeon.
Welcome to the Erotic Conclave, the second of its kind. Today we've got a list of distinguished guests on our podium who are going to enlighten us on why the aorta is the next latest organ. I would not take too much of your time and would request Dr. Tanu Shah to please take the conference forward.
Thank you all for joining us here. Now, this conference will focus on diseases of the aorta. Diseases of the aorta, its diagnosis, its treatment, and all the modalities combined together, including surgical as well as the intervention part. So, taking forward, I will just request Dr. Bashi to say some key words. He has been a mentor to many of us, including myself. So, Dr. Bashi, please.
Thank you, Achan, and thank you all for coming this afternoon. As he has already mentioned, aorta is the main tube which takes blood out. You can see the aorta being put there in the front. It takes blood to the whole body, including the heart. So it is so important that the diseases in the aorta has to be addressed properly, because it's all life-threatening. That is, if something happens to the aorta, the whole blood will be evacuated in 3 minutes' time and you will die. Any disease. So there are different types of disease which occurs in the aorta. One is, where the aorta dilates, that is, it becomes bigger and bigger and bigger. In different places it can happen. And suddenly, like a bulge, it occurs. And like a balloon, it bursts, all blood will go. Wherever you are, even if you are in the hospital, you may not survive if you come at that condition. That is one. Secondly, when there is, the aorta has three layers like, like if you take like that, 1, 2, 3 layers are there. So sometimes a patient with a high blood pressure, or sometimes people with a family history of aortic disease, when the tube may be weak, so blood can enter the layer and it becomes weaker and it can rupture. You will 90% of the patients will die in the first 24 hours. It is a surgical emergency. Now that is coming to the disease. So there are so many other factors which can produce this problem. One is by birth. Sometimes the aorta may be very weak. It is called certain, we call connective tissue disorders in medicine. That is, marfans, people who are very tall, joined, their tissues are very weak. They can have this dissection. Second is, one of the major risk factors is smoking. People who excessively smoke and who have high blood pressure, they can get aneurysms. They can get aneurysm in any part of the aorta from the beginning. They can have produced disease in the coronary arteries. It can develop blood vessels going to the brain. It can be affected. So, what has happened in the last almost 30, 40 years, as we all know, we have progressed, our country has progressed. Development of medical treatment is advancing. You see a lot of hospitals are opening up. Scans and scanning is one of the main things. Now, since the depth of the problem is very serious, we cannot just, we all have become experts in treating the disease. You understand? Because when I started heart surgery 45 years ago in CMC Hospital, Vellore, aortic aneurysm operation was a very big procedure. People surviving was a big news. Today, a patient dying after a heart operation is very big news. So all of us have improved together, all the surgeons in this country have got training abroad. We see videos like meetings like this with interact each other. Everybody presents their experience, and we learn from each other. So all of us have become experts in treating the disease. Now you have to highlight to the people how you can diagnose it and how you can prevent the disease from happening. One is you have to say that if blood pressure is there, it has to be controlled properly. Smoking. Government has put stringent laws. Still people smoke thinking they are going to live forever. They don't listen to their children nor their wives. When they suddenly comes with a problem only, they think, so it's better to avoid smoking completely. Tobacco in any form is bad. Secondly, when you have a problem, see like checkup, patients having, those who have got family history of heart disease. So if you have got an aortic aneurysm in your family, you have got at least about 10 times chance of getting an aortic aneurysm. For example, your brother has an operation with aortic aneurysm. Better to get our family members treated. Checked. Now, CT scan is like X-rays, olden days. 40, 50 years ago when we joined medicine, X-ray, CT scan, we never heard. Every new corner of the country we have CT scan. So you have got a hypertension. People who are over 60, usually it appears in older age group. Those with hypertension and smoking. Younger age group only familiar lateral weakness of the blood vessel wall something aneurysm. So people who are over 65 years or something will get a simple scan of the abdomen. It may cost 1 or 2,000 rupees. A chest X-ray, routine X-ray, scan aortic shortage. Yesterday also I had a patient who was totally asymptomatic and went for a little cold. The referring doctor took an X-ray and found aorta is dilated. So simple test can detect it early. Detection is very important. When the size increases, the chance of rupture is very high. So detection is prevention is better than cure. So you keep on, we go to the doctor, you may not need operation, all cases. When the size is small, doctor will say, okay, you come after some time, big, we will serially do this test, do this procedure and refer to the correct. So the public should be made aware the importance of this disease, and especially in a country like India, we have got 1.4 billion population. We should be doing about 5 lakhs of aortic operations a year if you compare the statistics with the US or UK. So hardly we are doing maybe 1 lakh. About maybe 1,000 cases, 1,000 or 2,000 cases all over India, where we should be doing 4 to 5 lakhs of cases. So the disease is already there, people's affordability is there, and we have people to treat and methods to diagnose this also. So the duty of the press is to inform the people. This is, don't take it lightly, avoid smoking. If you have a family history of all these things, you please have a checkup. It's like a mass level checkup when you are about 40 years of age. It is good. You may find out problems which you are unaware. Otherwise, you will be caught. Suddenly, you will say, oh, a patient has always had a chest pain. I saw him yesterday. Today he is normal. So all these are, majority of them are preventable, treatable with the expertise we all have. Everybody sitting here are experts in doing this procedure with very good success rate, equivalent to any part of the world today. Thank you.
Thank you, sir. I will request Dr. Fujikawa to say a few words, please.
Thank you. Thank you for your kind invitation. This is the first time to come to India after COVID-19, and I'm very happy to come back to India after 4 to 5 years after. I truly respect Dr. Bashi as this pioneer in this field. So, as a following generation, my curiosity is especially in the open aortic surgery. So, depending on the increasing population, especially in India and Hong Kong. So today I'm very happy to share my progress in Hong Kong again in India. Thank you very much.
Thank you, Dr. Fujikawa. I will request Dr. Milandu Das, our current head of the department of AREN Hospital. Sir, could you just kindly share a few words?
So, as you have heard, that this is a very complex disease and needs very urgent treatment sometimes. And these treatments are done only in specialized center, which needs a lot of backup, like blood bank,
interventions, radiology, intervention as radiology likes to grow. So these are done in the peripheral, not much in the peripheral centers, but major centers, probably Kolkata and other major cities of West Bengal. So if somebody has a chest pain,
আমরা যেটা চিরকাল বুক কেটে কাজগুলো করতাম সেগুলো আজকাল ভেতর দিয়ে কিছুটা কাজ করা যায়। ইনফ্যাক্ট বেশিরভাগ পেশেন্ট, যেমন অতনু আর আমি যখন কাজ করি একসাথে, আমাদের একটা অ্যাওরটিক টিম আছে। সেই অ্যাওরটিক টিমের ইম্পর্টেন্সটা হচ্ছে দের ইজ একটা পেশেন্টের জন্য কিছুটা সার্জিক্যালি কিছুটা এন্ডোভাস্কুলারলি করে গিয়ে পেশেন্টকে একটা বেস্ট রেজাল্ট দেওয়া যেতে পারে। এই কম্বিনেশন অফ ওয়ার্কিং টুগেদার ফর দ্য বেনিফিট অফ দ্য পেশেন্ট, এইটা ডক্টর দাস যেরকম বললেন সব জায়গাতে অ্যাভেলেবেল নেই। এটা একটা হায়ার স্পেশালিটি সেন্টারে যেখানে এক্সেপশনাল কোয়ালিটি ইমেজিং আছে, এক্সেপশনাল কোয়ালিটি ক্যাথ ল্যাবস আছে, এক্সেপশনাল কোয়ালিটি সার্জিক্যাল স্কিলস আছে, ব্যাক মানে ইন্টেন্সিভ কেয়ার ব্যাকআপ আছে। আমাদের এখানে অ্যাওরটিক টিমের আপনারা মাত্র 2-3 জনকে দেখছেন, অ্যাকচুয়ালি দ্য অ্যাওরটিক টিম ইজ লট লার্জার। সেখানে পারফিউশনিস্ট আছে, সেখানে নার্সেস আছে, সেখানে ইন্টেন্সিভিস্ট আছে, অ্যানেস্থেটিস্ট আছে। ইটস এ বিগ প্রজেক্ট। এবং আমাদের প্রত্যেকটা পেশেন্ট যখন আসে, irrespective of কার কাছে পেশেন্ট আসছে, it is actually seen by the aortic team. So the patient actually gets 2 opinions or 3 opinions at the same time. And this is the key, that you work together for the benefit of the patient. Because every patient's aorta and the problem is slightly different to the next patient. So therefore, which suits which patient is something that we can discuss as a team. So that is what we do provide in Narayana Health, and there are centers across the country that does it. One key message that should go out is that the service that is provided, the expertise that is provided, is actually not much different to what is provided in rest of the country. So amader je typical, there is this approach, and there is a desire to go out of the city or out of the state to seek an opinion. That is fine. Of course, everybody is entitled to seek opinion. But to be honest, the facility and the expertise is available locally. So I find it difficult that a not so well off patient having to travel outside with the entire family. It is not conducive to good healthcare delivery. So I think one of the things that we as a group, or as all of us as doctors, would like to impart in this part of the country is to increase confidence in the people that actually these are available locally. And lastly, there are 2 more things I would like to say. One is about the cost. Unfortunately, our healthcare system is still not driven by no cost basis. The healthcare is not free at the point of delivery. So therefore, when a patient comes, like currently right now we have 2 or 3 patients that we are discussing, and the major impediment to delivering the right treatment is the cost. The devices are expensive, procedures it takes a lot of hospital time, so they are not cheap. Now, I think press has also got a role in trying to inform the government that something needs to be done about how can these people be taken care of. Because if I ask any of you, you are reasonably well off, cough up 15 lakh rupees tomorrow, would we be able to? I mean, I can't. Most of us can't. So therefore, it is not so easy. So I think press also has a role in raising the awareness, not amongst only about the public, but also amongst the government, to say that this is something that is important. And lastly, the other thing I wanted to say is that any disease, aortic disease bolun, colon cancer bolun, cervical cancer bolun, aortic disease is something that is treated better when detected early. So we are one of the pioneering institutions which offers aortic screening. Bilete, smoker above the age of 50 or any person above the age of 60 gets an aortic screening scan. We offer that service. It is cheap, 1,000 rupees. Patients can come, people can come, get their aorta checked. People who are come to Dr. Das for their heart disease can also get their aorta screened at the same time. Because if we detect it at a stage where it has not become a complicated aorta, then the cost is less and the treatment is easy. So in summary, I would like to say that, number of centers in Eastern India, including ours, do offer quite state-of-the-art aortic service. There needs to be markedly increased awareness that this service is chikitsagulo locally available, and it does not need, of course, don't get me wrong, there are cases they are rare and we would want to. So we get this gentleman to come and discuss with us. I mean, the people who are very senior, who has done many more cases, they come, they give opinion. For a typical aorta case, you will not believe that apart from myself, Atanu, Dr. Dash, Pradeep here, there are 3 other people that we are ringing, sharing images and getting opinion from. So, because we want to give the best to the patient, and we are grateful that NH offers us doctors a platform whereby we can do this. Thank you.
She came back after, say, just last year, after 12 years of the initial operation with a huge dilatation. Huge dilatation of the rest of the aorta. The point that I'm trying to make is aortic disease, once affected, can be a problem for the lifetime. So they require proper follow-up. So we had operated on her last November, and it was a very complicated operation. It took around 12 to 14 hours, and her entire aorta is now replaced. So she has her entire aorta replaced. This is a classical example where screening is very important in family members. Or first aortic dissection ওর হয় কিন্তু তারপর ওর মার হয়েছে, তার মানে কি ওর মার কিন্তু প্রবলেমটা আগে থেকেই ছিল. So both of them are doing well and she is currently recovering. Thank you Malavika for coming here. So from the onset of symptom till the treatment, I think it took a week. 14 days. So his arch was torn, he has extreme fluctuations of blood pressure and he never knew where to go. He stays next door to us, he stays in Alipur. So this is the important message that we want to convey. Yes, experts are there all over, but they need to know where to go. So কলকাতায় বসে 10 কিলোমিটার দূরে বসে একটা পেশেন্ট যদি 14 দিন পরে আসে, তাহলে আপনি বুঝুন গ্রামগঞ্জে পেরিফেরি থেকে তার কি অবস্থা. So this is a very important message that needs to be carried home. Thank you.
मेरा नाम डॉक्टर शुभ्रो रॉय चौधरी है. मैं नारायणा हेल्थ केयर ग्रुप का तरफ से मैं आप लोगों से बात कर रहा हूँ. मेरा कॉलीग डॉक्टर अतनु शाह, डॉक्टर प्रदीप सर्जन्स, कार्डियक सर्जन्स यहाँ पे हैं. हम एक इंटरवेंशनल रेडियोलॉजिस्ट हैं. हमारा जो मेन काम है, हम एक साथ मिल के एओर्टिक डिजीज़ जो है, हमारा जो मूल जो धमनी है जो हार्ट से निकल के पैर की तरफ जाते हैं, उसको जो बीमारी होते हैं, उस बीमारी को कैसे इलाज किया जाए, इसके बारे में आज हम लोग बातचीत कर रहे हैं. और उसके बारे में लोगों के बीच में थोड़ा पब्लिक अवेयरनेस रेज करने के लिए आज का ये सम्मेलन किया गया है.
হ্যাঁ, বেসিক্যালি এওটা হচ্ছে একটা মেইন পাইপ যেটা সারা শরীরের রক্তটা হাই ব্লাড প্রেশারে চতুর্দিকে ছড়িয়ে দেয়. এই পাইপটা যখন দুর্বল হয়ে যায়, উইক হয়ে যায়, ব্লাড প্রেশার বেড়ে যায়, এটা একটা বেলুনের মতন, যে কোনো সময় ফেটে যেতে পারে. এটা যদি ফেটে যায় তখন কিন্তু এটা ফেটাল, মানে আমরা তখন কিন্তু পেশেন্টকে কিছু করতে পারি না. সুতরাং ইম্পর্টেন্ট ব্যাপারটা হচ্ছে এই জিনিসটাকে ধরতে পারা ঠিক সময়, ফেটে যাওয়ার আগে. কী করে বুঝবেন? বুকে ব্যথা হচ্ছে, শ্বাসকষ্ট হচ্ছে, ইয়াং পেশেন্ট, ফ্যামিলিতে কোনো হিস্ট্রি আছে, তার কোনো সাডেন কার্ডিয়াক ডেথ হয়েছে ইয়াং বয়সে, এগুলো কিন্তু মার্কার্স. এই মার্কারগুলো যদি থাকে অবশ্যই কিন্তু চেক আপ করে রুল আউট করতে হবে যেটা কোনো এওটিক ডিজিজ কিনা. মেইন ভয় হচ্ছে আমাদের এওটিক ডিজিজের যে ল্যাক অফ অ্যাওয়ারনেস. আমরা কিন্তু জানি না যে এওটা থেকে কি হতে পারে, কি ফেটাল কনসিকুয়েন্সেস হতে পারে. আমি এখানেই একজনকে দেখালাম, তার এওটায় ডিজিজ হয়েছে, সে জানে তার এওটিক ডিসেকশন হয়েছে, সে ট্রিটমেন্ট পেতে তার 3 মাস লেগে গেছে, 3 মান্থস. এই জিনিসটা কিন্তু আমাদের অ্যাভয়েড করতে হবে.